Hello, everyone, and welcome to Zero's coverage of Giving Tuesday Now, right here on Facebook. Today, we'll hear from prostate cancer patients who are on the front lines of the COVID-19 pandemic. We'll also be hearing from doctors, caregivers, donors, and many more as we try to raise $25,000 today toward our Zero COVID-19 Support Fund. That fund allows us to help prostate cancer patients through our key support programs, and one of those programs is ZERO360. We begin today's special coverage with an admired and beloved member of the Zero family to share just how important ZERO360 is. Please welcome Duane Holmes. Hey, Duane, how are you?
Hey, thanks, Jamie.
Thanks
Great
for
to
coming
talk
on.
to you.
Thanks for joining us today on Giving Tuesday. Would you share with everyone your prostate cancer journey and when you first found Zero?
Well, what happened to me was my diagnosis was myth. They didn't catch it till I ended up in the hospital one night with kidney failure. And what happened was that my PSA always ran very, very low. And so my urologist just apologized over and over. He just flat out missed it. But I ended up in the hospital that night with a suprapubic catheter, which I've had for 7 years now. And the very next day, I had a biopsy. And that biopsy gave me a Gleason score of 8. So it was aggressive, and it was all over my prostate. Had scans right afterwards, and it showed that it was stage 4. It had spread to my bones, my ribs, and my hips. So I started doing research right away, and of course then urology, they helped give me some information and so on, and a lot of just helps to know what you're up against and what we're doing. But I immediately went on ADT, Lupron in my case, and Exgeva to help with the bones. And anyway, that as I neared 65 now, that was when I was 61, so it'd been 4 years, and my bills were tremendous. It was devastating, really. It's like, but my insurance was covering things, and I was doing okay. But that's when I got into the 360. I had ran across Zero quite often. It started with the run walks, is where I first learned about it. We'd go to our run walk in town here, and it was great. We had a really good time, a lot of good information, vendors. That's where you would learn about other drugs. They were just, it just helped tremendously. So anyway, that's when I found out about the 360 program, and I was concerned about my Medicare was going to be coming up, didn't know what it was going to cover, and you hear all these things about all these other plans, the Advantage, and what insurance help you need, for say the 20% and so on. So anyway, got contacted with 360, and you would not believe how great my caseworker was. I was assigned a caseworker that she was just, I can't give enough superlatives. She was the best. We
Yeah,
would
give us a few
contact.
examples of how she was helpful. That's great
Well,
to hear.
she okay. First of all, we started out with all the different types of plans you could do, the different types of things, and then we started contacting companies, and that's where you would not believe her. We would discuss things ahead of time, kind of have a little plan, and then I don't care who we talk to, a broker or a salesman or a vice president, or she was amazing. She would jump in there, and she had all the right questions to ask, and inform me of maybe some of the things that I might want to say to them and ask. And then if when I failed and didn't do it, she jumped right in there. And I had a dining room table here that was just littered with information. And she helped me wean it down to just the best things that we could look at. But I just can't express the gratitude and how great she was. Intelligent, and I mean, she was a wealth of information.
And when you're in contact with somebody like that so often, you almost really develop a relationship, a friendship.
Absolutely.
And, tell me what it meant to have somebody just shoulder to shoulder, or somebody to be a hand to hold on to through your journey.
Oh, that's absolutely the truth. And it's kind of funny because I couldn't help but smile when I talked to her. I just couldn't help it. She was so good, and especially when we were on the phone and talking to other people, she just so intelligent and so good. And I would look forward to our phone calls. We'd plan them all, depending on what we were going to be working on, maybe a week apart, 2 weeks, whatever. And it was something to look forward to.
That's incredible. And then since the COVID-19 pandemic had broken out, we're hearing about more and more patients and caregivers who are reaching out to us all the time who are in urgent need. Recently heard from a stage 4 prostate cancer patient who is living on limited income because of his hours were eliminated at work. And because of COVID-19 and the cutbacks and layoffs and furloughs and all that. And he was running out of his medication and was seeking assistance with his costs, and ZERO360 stepped in, and another case manager was able to help him facilitate a conference call and get him financial assistance. I believe he got about $7,500 and copay relief to help keep him in his fight, to keep his journey going. Duane, I'm sure you think about guys who are going through prostate cancer during this crisis, just like I am, right?
Absolutely. Absolutely. And the COVID-19, it just changed everything. I go to my urologist and I sit in my car and call, and they come out and get me, and there's nobody in the waiting rooms. And I asked the nurse about that. Well, are you not as busy? They're busier than ever because they have to change how they do things. Some of them are laid off every other week or whatever, but the COVID has just changed everything, and it's got to be so.
Yeah, I can't imagine having to manage both prostate cancer journey and worrying about getting the virus all at the same time. Have you ever thought about in the last month or so, since really actually more than a month, it feels like it just goes on and on, almost 2 months now. Ever thought of, I'm just not going to go in, the risk is just too high?
Yeah, it's like we've been just staying at home, except that I had all these appointments. I went through radiation during this time. So here it is, every day for 12 days. I went in there, and they were real careful that people didn't, come into each other. But yes, absolutely, you kind of wonder. And I had an appointment with my GP. There was, a lot of things going on there. I kept thinking, well, they were going to cancel. No, we did it. And I did have an oncologist visit that we did do over Zoom, and it worked out great. Right now, my doctors are working on plans for maybe a possibly different medication. We had a genetic test for maybe some targeted therapy because maybe things are going a little south here. So anyway, all through this COVID, I've still had a lot of doctor appointments. It's about the only time we go out, and I still had a bunch of them. And yes, you do wonder. You try to protect yourself and the doctors and caregivers all you can. For instance, I go to the hospital every week because I have a nephrostomy tube where the dressing has to get changed. Mm-hmm. And of course, that's kind of a scary. And I don't know. All I can say is all the caregivers and everything have been really just great. But on the other hand, it's scary stuff.
It's great. Yeah, I'm getting phone calls every week over the last few weeks from prostate cancer patients who can't get the treatment or the care that you need, but it sounds like you're in a good position now. But I'm also getting phone calls from guys who have a high PSA who are having to wait to get a biopsy done or get a scan done. So really they're sitting on pins and needles just waiting to hear what is the next step in their prostate cancer journey. But ZERO360 helps meet the urgent need that men are having right now during this pandemic, or despite of this pandemic. So on Giving Tuesday today, donations to Zero's COVID-19 support fund are needed to keep this program going and being able to help patients. What would you say to someone who's considering a donation to help out with this fund, since you were able to benefit from ZERO360?
Your money couldn't go to a better place. Zero is looking out for prostate cancer patients, and it's just, they're the best. So your money is going to be well used, and it's well worth it.
And Duane, how are you and your family doing right now, health-wise, and how are you handling the pandemic? Are we going stir crazy? Are you guys handling it okay?
Well, we live out on an acreage, so I always have something to do. It's not a problem. Me and my wife, we do okay there. And like I say, with all these doctor appointments, we still end up driving back into town. It's brutal. And I'm a little bit concerned at this time right now. In our state, we're a little bit behind, and I'm concerned about them opening up things a little bit too soon, maybe. And I don't know. It's just a scary thing.
Well, stay safe and well. I know that you were saying before we got on the call that you've got one of those Zero bandanas that we sent you, so you've been using that as a face mask, and I know you've got your shirt on. Show us your shirt real quick. All right. We're proud to have you as a Zero champion, and thank you for always being there for us and being part of the Zero family and supporting us. And I also want to thank everyone who's already donated today. Please continue to watch our coverage all day long today on Facebook. And we have so many brave and amazing patients and Zero champions that we want to bring to you on Facebook for you to meet. And don't forget to donate right here on Facebook, or go to zerocancer.org/donate. Thanks, Duane. Thanks for joining us today. Stay well, keep fighting. We've got your back, and stay Zero strong.
Thanks a lot, Gene. You guys are the best.